We're all back from COP28 now. It was quite a trip to Dubai, and Healthcare Without Harm is really proud of the fact that we were able to, in the lead up to COP, help convene leaders of organizations representing more than 46 million health professionals, calling for a rapid, just, healthy phase out of fossil fuels and a just transition to clean, renewable, healthy energy. We brought that coalition to COP. That health voice was really important in advocating for a fossil fuel phase out. And the health sector's advocacy contributed to the world's governments agreeing for the first time ever that we need a transition away from fossil fuels, the root causes of the climate crisis. It took 30 years to get there, but we finally got there. The agreement provides hope for the systemic change we need to avoid a warming trajectory that will have catastrophic consequences for our hospitals, for our health systems, and for people's health, undermining any progress made by the health sector. The Dubai Consensus has loopholes around natural gas and carbon capture and storage that are big enough to drive a diesel-spewing truck through. But nonetheless, it is still an important move in the direction of a fossil fuel-free future for health. It's also really important to recognize the progress that was made by the health sector in Dubai. This year at COP28, we had the first ever Health Day, a ministerial, and a climate health declaration signed by 145 countries. And there are also now 83 countries that are part of the Alliance for Transformative Action on Climate and Health. These are really important gains. We had an amazing team in Dubai, and they're going to tell you more. So let's hear from them.
It's just really been nonstop a few days.
Just to see the energy and the excitement around the work that we're doing in climate and health, it's just amazing to see.
So today is the first ever Health Day at COP. More than 135 governments have signed a declaration. We think the declaration could have been stronger. It could have had reference to the phase out of fossil fuels in it. It could have called for more accelerated action. Nevertheless, it's a huge step forward that so many governments and so many health ministries are on board with the agenda of climate and health.
I'm really proud of the work that we are doing and the messaging that we are bringing into this space.
Because later is too late.
There's a lot of global south voices, and there's a lot of women as well in the delegation, and women who can stand their own.
It was just a really generous, community-driven environment, and it was amazing to be with everybody.
I'm inspired to see health workers show up in bigger and bigger numbers. There is an entire community here that is demanding accountability and that is here to say we are much more than what one person, however powerful he or she may be, can do.
The support of the health community for fossil fuel phase out and for equitable just transition is so strong, and I think with a unified voice there's lots of glimmers of hope.
I think there are a lot of new discussions, much more about climate justice and equity that I have ever heard.
We need to understand that climate change is impacting us very badly, and especially the vulnerable populations in the coastal communities and other marginalized environments.
As someone from Southeast Asia, I come into a space like COP not as victims. I come here to bring solutions from our Southeast Asia community, and I think our unity, our solidarity, and the solutions that we have at hand is something that needs to be leveraged at COP28 and in bigger global spaces.
While things are looking up with the Health Day at COP, we've still got much further to go. There's a lot more that healthcare can provide in terms of this conversation.
For many countries, health has not been at the table for the longest time. So it is really significant to have over 70 health ministers attending COP and really seeing what this space is about and how they can actually contribute very tangibly to the work. And that the fact that we got the Climate and Health Declaration, it's momentous. It is, however, just the first step.
The work is not done. There's so much more work that we need to do. And I look forward to going back and continue working with ministries of health, with partner organizations, with our health professionals, with our health facilities in the region to really achieve what we want for the future, which is a just, healthy, and resilient future for all.
So a healthy planet and healthy people on a healthy planet is something which fossil fuel free world will ensure. I'm very sure about it.